Health in nature is very complex. It takes a lot to really come together and figure out how to solve really complex issues. With that comes partnerships with different individuals and organizations in the social sector, as well as the city and county, figuring out how we work together so that we can make sure the patients get what they need.
Most folks don't know that when it comes to your health and well-being, probably 11 to 15% of it is your clinical care. The other lion's share of it is actually those social determinants of health.
Which is kind of new. You know, when I first got into medicine, that's not the kind of thing that a health system would get involved with. This was not something that St. Peter's was doing back when I came back to town. I certainly wasn't doing it when I was growing up here. But now we're seeing that as a valuable role that we have to try to bring these people together.
Helena has a lot of great organizations that are all striving to do amazing things for our community. I've had the privilege of being able to work with a lot of these organizations over the course of the few years that I've been in population health, and coming together and really trying to solve it collectively is really empowering.
We have never felt the need to lead in all the great things that are going on in the community. We do feel an obligation, a responsibility to convene and to bring people together and to partner. We have so many organizations in the community that are doing wonderful work. Our job is to not get in their way, but to help support them where we can.
In a lot of things in healthcare, doing the right thing doesn't always mean that we will be reimbursed in the hospital. So St. Peter's does have a really big heart in giving back to our community, and we are thankful for all of the donors that allowed us to bring this program together.
I think there's some measure of obligation to work together to make sure that we're using those as wisely as possible, stretching those dollars as far as we can to better the community for everyone.
It's our duty to help our community members when they need it. And some of us might need it some point too. And that's how a good community works. We all take care of each other.
Our patients often move throughout all of these different organizations at different times. And so in order to coordinate their care, in order to address the community need that we have to work together. Otherwise, it just becomes disjointed and people get lost in the process.
It isn't law enforcement's expertise to educate kids about nutrition. It isn't our expertise to talk to people about how to stay out of the criminal justice system. But when we bring people together in the room and get to talking about the solutions, that's when we can really make some progress.
I think it's just a matter of relationships. So I think it starts with the relationships that we're able to build and having relationships with them so there's not a hesitation ever to pick up the phone and make a phone call and say, hey, we're thinking about this. What do you think?
Once we figure out how we can solve one problem, Helena will move to the next and figure out how to work together. Sometimes it's about bringing all of us together in a room and figuring out how we can solve it together collectively.
I'm just inspired by the people that I work with who are so passionate about these causes and helping these people. Just seeing the success stories that we see every day is enough to keep us going and let us know that this is a worthwhile thing to do.